there, I'm Jo. I'm a pregnancy postnatal exercise specialist. I am also a maternity nurse, so I care for mums after birth in the hospital setting, and I am also a mum of 3 myself. I started my business because of my own birth experiences and the things I wish I knew that I discovered and made my third pregnancy and birth so much better. And I really want to share this with all mums so that they can have better pregnancy and birth experiences, as well as recover optimally so that you can return to full function, so that you can live your life without restriction and your pelvic floor muscles or your body, your aches and pains or injuries holding you back. So today I have got you a little freebie, a educational video on how pregnant mothers who are wanting to prepare their body for a normal vaginal birth, to reduce the risk of needing intervention, sustaining nasty tears, episiotomies, forceps delivery, suction cups, or C-section deliveries. So one of my top tips here is to prepare your body with movement and exercise, and the ultimate foundation of all of the exercises I teach is always going back to your breathing, to connect with your core system and your pelvic floor muscles. Okay, so sometimes we get symptoms such as leaking or pelvic floor heaviness in pregnancy. That's always really awkward and uncomfortable. I know I have been there, particularly with my own postnatal recovery and pelvic floor, a lot of pelvic floor symptoms that I have discovered ways to manage through this technique. So your pelvic floor muscles, let me quickly explain those. I have my pelvis here and I have my core system here. Okay, so this is a pelvis. We all have one. We all have pelvic floor muscles. So I'm going to come in a little closer here. These red bits are all our pelvic floor muscles, okay? They are a sling of muscles that sit within our pelvis. There are outer layers and more deeper internal layers, okay? They hold all our internal organs in, so our bladder, our bowel, and our uterus, and our babies, okay? And they control our toileting habits and play a part in sexual stimulation. So these muscles, for your baby to get out with ease, for your birth, your labour and birth to go smoothly, we want to be able to really connect well with these muscles and be able to lengthen and relax these muscles so that they can let go and just get out of the way so your baby can get out, okay? So what I'm going to teach you is to connect with these pelvic floor muscles so they can relax and lengthen and get out of the way, okay? If we want to strengthen these pelvic floor muscles, we can do this throughout pregnancy and connect well with your core up until about 35 weeks. And then we want to, by activating and strengthening these muscles, so like a Kegel lift and let go. But after 35 weeks, we want to probably, don't worry about that lift and strengthening, we want to let go. Okay, and there's lots of other ways we can do this. I'm just going to talk about your breath today. Okay, so if you think about either lying down on your side or sitting on a Swiss ball, a birth ball, or grabbing a rolled up cushion and sitting on it so that you're able to feel those pelvic floor muscles, kind of those muscles that you relax to let go and go to the toilet, those muscles where your baby's going to come out on top of the cushion, okay? And then we have our core system here, so we have our breathing muscle goes up and down as we breathe. So inhale, that breathing muscle goes down. Exhale, that breathing muscle lifts a little. Okay, this is quite restricted towards the end of pregnancy because your baby's growing up into it. All right, so we want to think about inhaling and letting that pressure go down into your baby bump your baby bump's going to expand a little and press down into that pelvic floor. A little bit like squeezing a tube of toothpaste. If you squeeze from the top with your toothpaste upside down, the pressure's going to go out the bottom and squeeze that toothpaste out, okay? So we're going to think about your core as a pressure control system. So we inhale into our ribs at the side. Notice that baby bump expand a little and down into those pelvic floor muscles. Now we're sitting on this rolled up cushion or your ball, and you might feel, and we're going to work on feeling those pelvic floor muscles just expand a little bit into that cushion. Now you've got a little bit of feedback here to work with, okay? So inhale, feel those pelvic floor muscles relax into that cushion, and then just exhale. And you can draw you might feel your core just turning on a little bit, or your baby bump just activating a little bit. That's those deep core muscles that we're wanting to connect with. So inhale, feel those pelvic floor muscles really just push down slightly into that cushion, and exhale. Inhale in through the nose, past the throat, down, inflate all of those little cells in your lungs, ribs out at the side and the back. Bump expands, and exhale. And let that breath go all the way out. One more, inhale in through the nose, through past the throat, down into your lungs. Baby bump expands, pelvic floor expands and relaxes, and then exhale. Let it all back out. We're wanting to make sure that we're not breathing up into our shoulders. And we're also wanting to think about our posture, because our posture changes a lot during pregnancy, okay? So the change in probably the tilt of your pelvis will also impact how your body is functioning, your aches and pains, how your pelvic floor muscles are able to respond and let go. If you're having particular pains in that pelvis, then you might be holding a lot of tension around there because it just hurts to move or you're uncomfortable. So it's really important to connect well with your pelvic floor, your core, your breathing, and then you can kickstart that straight away after birth as well, with your pelvic floor activations again to get that function back without, and being sure to ensure you really expand and relax those pelvic floor muscles through their full range of motion. All right, so I have a whole program on this. It's a 7-day educational program. There's some exercises in there, including this pelvic floor education, but there's also different ways to move your pelvis and your hips to help ensure your pelvis can move well to get your baby out. And those mobility exercises also connect and help you relax and release any tension throughout your pelvic floor. So there's more to more than just breathing, to relaxing your pelvic floor muscles and making sure that your full entire body and your core is all in optimal condition and function to the best that it can be at the end of your pregnancy, for your baby to line up in the optimal way and to be able to get out with ease and without causing too much trauma or injury to your body, which is what I really, really, really want for you. So I will pop the link to my 7-day program in the comments, as well as a sneaky little discount code, because my goal for my business is to bring this support to you through an online platform so that it is affordable and accessible to everybody, because everybody needs to know this information. They deserve to know it. And the amount of blank stares I get about pelvic floor function and recovery after birth when I talk about it with the new mums that I care for on their discharge sort of process is just astounding. So you deserve to know this. I didn't know this, now I do, and it made a huge difference for me. So here it is for you. Keep striving for optimal function, so you can get back to living your life and live your life with your kids, not just watching from the sidelines because your body can't handle it. All right, please sing out if you've got any questions and share with your friends who need to know this.